Bismillah ar-Rahman ar-Rahim. The following of connective tissue. Here in this slide we have this second component of connective tissue. As you remember, the first component was the cell, I explained that, and here we have a fibers, the second component of connective tissue. We have three types of fibers in connective tissue. The first one is collagen, the second one is reticular fiber, and the third one is the elastic fiber. The first one and the second one, I mean the collagen and reticular fibers, are formed from the protein called collagen, both of them. And the last one, the elastic, is formed by protein elastin. The elastic fiber is formed by protein elastin. Let's start with collagen. Here you see a schematic picture from the connective tissue. You can see the three kind of fibers in this connective tissue. Collagen fibers, you can see we have a thick fiber, then elastic fiber, we have somehow branched and very thin, and the reticular fiber, they are very thin, also again the branched fiber. Let's start with collagen fibers. Collagen fibers, I said, is formed by a protein and collagen. Collagen is a big superfamily of proteins. We have about 28 types of collagen in our body and also in other vertebrates. And also it's the most abundant protein in our body. It's most abundant protein in our body, and also make about 30% of our body dry weight. It means again it's the most abundant protein in our body. Under the electron microscope and light microscope we can see the collagen fibers. In both electron microscope, I mean in the SEM and TM, both of them you can see the collagen fibers with transverse striations, some depression on collagen fibers. And also under the TEM you can see the transverse sections and longitudinal sections of collagen fibers, again with a striation alternating dark and light bands on the collagen fibers. Then I will explain why we have this striation on collagen fibers. And under the light microscope you can see the collagen fibers in red. It means they are stained by eosin, and the collagen fibers are acidophile. If we want to determine the rate of collagen in our tissue, we have to stain it by a special staining. For example, the Mallory trichrome or Mason trichromes. Mason trichromes stain the collagen fibers in green, and Mallory stain in the blue. By this staining we have exact collagen fibers. You can see the nucleus of the cells, and we don't have a staining of the cytoplasm. But in H&E staining, in the routine staining, we have, you can see here, we have collagen fibers in red and also the cytoplasm in red. But in the special staining, we just have a staining of the collagen fibers without a staining of the cytoplasms. Another special staining for the collagen fibers, Sirius red. You can see the collagen fibers stained in red without a staining of the cytoplasm. About the collagen synthesis, as you know, all of the, or most of the protein produced in two organelles, RER, rough endoplasmic reticulum, and Golgi apparatus. Within the RER that start the protein synthesis, we have polymerization of amino acid to make a polypeptide. In collagen, we call this polypeptide alpha chain polypeptide. Each alpha chain have three parts: the central domain or central part and two terminal domain or terminal part. The central domain is rich of one amino acid, glycine. Every third amino acid, one of them is glycine. And two other XY can be every amino acid, but in collagen we have more proline and lysine amino acid. So we can say the central domain of each alpha chain is rich in glycine, proline, and lysine. After formation of alpha chain polypeptide, or we can say pro-collagen alpha chain, in the next step we have hydroxylation of proline and lysine. You can see adding hydroxyl group to the proline and lysine by two enzyme, proline hydroxylase and lysine hydroxylase. We call this step hydroxylation. After this step, we have a glycosylation, adding the sugar to some of hydroxylysines. You can see some sugar added, carbohydrate added to some hydroxylysines. Some of them are, you can see, they are free of carbohydrates. After glycosylation, T of these alpha change start to twist each other or intertwine to other and make a triple helix inside of the Golgi apparatus. Triple helix. We call this triple helix pro-collagen. Pro means the before. Pro-collagen. Then after formation of this triple helix, the cell secrete this pro-collagen outside of the cell by exocytosis. Immediately after coming out of the cells, in the extracellular matrix, we have a protein pro-collagen peptidase. We have this enzyme out of the cells. After secretion, this enzyme remove two terminal domains and just remain the central domain. Now we call this part collagen molecules or tropocollagens outside of the cells. This rod-like structure after formation start to assemble automatically and form other types of collagens. Another picture also shows the collagen synthesis. You can see inside of the cells, especially in the fibroblasts. You know, the fibroblasts, I said, is specialized for synthesis of the extracellular matrix in connective tissue. However, other cells also can produce the extracellular collagen in the extracellular matrix, like osteoblasts, like chondroblasts, like smooth muscle cells. But the fibroblast is specialized for this synthesis. You can see the areal organelles, and after that we have Golgi. Within the area you see the assembling or polymerization of amino acid and making a pro-collagen alpha chain. I said this alpha chain rich in three amino acid, glycine, proline, and lysine. The next step is hydroxylation of proline and lysine. The enzyme that adding the hydroxyl group to the lysine and the proline for doing this function they need some cofactor. Cofactor means the material help the enzyme to do its function. Here, for these two enzymes, the cofactors are oxygen, iron ions, and vitamin C. These are cofactors for these two enzymes, especially the vitamin C. You know, when we have a cold, exactly we have an inflammation in our body, and the site of inflammation we have a destruction of collagens. And for the replacement of this collagen, we need to renew it by the fibroblast. And one of the factors help us to refresh this collagen, this damaged collagen. We need to drink or eat a vitamin C. Because of that, we are suggested to eat a lot of vitamin C during the time we have a cold, because the vitamin C helps these two enzymes to make correct collagen fibers in our body. After and the next step is the glycosylation, adding the sugar to some hydroxylase. And after glycosylation, we have twisted of three of these alpha chains together and make a procollagen molecules. Then cell secrete these procollagen molecules outside of the cell, and immediately the enzyme procollagen peptidase remove the two terminal called the globular domain, because you can see the terminal domains doesn't make it triple helix, and they have globular structures, and by this enzyme this globular structure removed and just remain the rod-like part or the central part. And after this rod-like structure called the collagen molecules. And then see we have an assembling of these rod-like structures. Again, another picture shows us the frequency of glycine and also the proline and lysine in the alpha chain, and assembling of collagen molecules by a cross link. Again, in this picture you can see triple helix. For example, here 2 alpha 1 and 1 alpha 2. The cells produce different types of alpha change with variable lengths and also sequence. And because of these variation, we have 28 types of collagen in our body. After secretion, you can see the assembling of these triple helix or collagen molecules and forming a collagen fibrils. And in the collagen fibrils, you can see the striation or depression on collagen fibrils. This depression is because of this gap between the collagen molecules. And repetition of these gaps make it this depression on collagen fibrils. And then we have assembling of collagen fibrils to make a collagen fibers, and assembling of collagen fibers make a bundle of collagen. Some collagen doesn't make a collagen fibrils and make a sheet instead of the fibrils, called, for example, collagen type 4. Some of them make a collagen fibrils like a collagen 2. Some of them make a collagen fiber like collagen 3, and just one of them, from 28 types of collagen, just one of them make a bundle of collagens, and that is collagen type 1 is abundant collagen, is most abundant collagen in our body. 90% of our body collagen is collagen type 1. The one reason for assembling or automatically assembling of collagen molecules is the cross-linking of the collagen molecules together by an enzyme outside of the cells called lysyl oxidase. You can see the lysyl oxidase attached to lysine acid or amino acid together and make a cross-link between two collagen molecules. Here we have a classification of the collagen in our body. We classify the collagen in 3 groups. The first group have the fibrillar collagen, means the collagen can make a fibril. For example, collagen 1, collagen 2, collagen 3, and collagen 5, and collagen 11. You can see we use a Roman numeral for calling the collagen types. And also in this column you can see the distribution of this collagen in our body. For example, we have collagen type 1 in our skin, in our bone, in our tendon, and also our dentin. And for example, collagen 2 we have in our vitreous body, in our cartilage. Collagen 3 we have our skin, muscle, blood vessels, and so on. So you should know the name of the collagen and the site of distribution of this collagen. You should memorize this. The second type of collagen groups is sheet-forming collagen. Collagen type 4 and collagen type 10 are placed in this group. You know we have collagen type 4 in all basal and external lamina. And the third group is linking or anchoring collagen. You know one of them is collagen 7. We have this collagen in our basement membrane, attaching or anchoring the collagen type 3 or reticular lamina to the basal lamina, and also other collagens. Some people have a problem, a defect in collagen synthesis. You can see example of this disorder in some patients. Some of them calls Ehlers-Danlos disorders. For example, 3 of them you can see here, Ehlers-Danlos type 4, 6, and 7. And they have a problem to collagen synthesis. For example, here you can see the type 6 have a faulty in lysine hydroxylations. And because of this or defect in collagen synthesis, some of them have an increased articular mobility or increased laxity of joints, and also some of them have an increased skin elasticity. As you know, some of these persons also registered in a Guinness Book as a hero. And but it shows us they have a more problems in collagen synthesis. Another problem for collagen synthesis is after wound healing, we have a high amount of abnormal collagen in site of healing, cause the scar, a wound scar in site of healing. Call it the chloid, especially in a black descent. We have this kind of disorder. You can see again another picture of chloid. And after surgical removing of this chloid, unfortunately, is followed by a recurrence. The second fiber is the reticular fiber. Reticular fiber is formed by collagen 3. Collagen 3, usually by H&E staining, we cannot see it because it's very delicate. We have these fiber in a delicate connective tissue, especially in immune system tissues. But by spatial staining, particularly silver salt or PAS, periodic acid shift, we can stain the reticular fiber. By silver staining, we can see the reticular fiber in the dark or black, and by PAS staining, we can see the reticular fiber in red. The staining of reticular fiber by these two stain is because the reticular fibers have a high amount of carbohydrates. About 10% carbohydrates we have in reticular fibers, but the other collagens, other type of collagen, have up to 1%. And this high amount cause the staining by a silver stain and also PAS. Because these fibers stained by a silver salt, we call them argyrophilic. Argyro means the silver and philic means the low. They like to stain by a silver. Another picture for the staining of the reticular fiber in a basement membrane. You know, the basement membrane have a part reticular lamina. This part is formed by collagen 3, and we can stain it by PAS staining, called PAS positive fibers. And the third fiber is elastic fiber. Elastic fibers have two components. The first one is microfibrils. Microfibrils is formed by glycoprotein, especially fibrillin. And the second part or second component is a protein elastin. These two components make elastic fibers. During the development, first we have a formation of the microfibrils by fibrillins. And these microfibrils make a scaffold that is very necessary for deposition of elastin. You can see start of deposition of elastin and accumulation of elastin, and these structures form elastic fibers. Another real picture also shows us the elastic fiber formation. In the first step, we have a formation of microfibrils from fibrillin. You see the longitudinal section of these microfibrils, and these microfibrils make a scaffold for deposition of elastin protein. And in the next step, you can see the deposition of elastin between the microfibrils. But here we have a cross section, or we have a transverse section of the microfibrils. And at the end, we see the accumulation of elastin in the center and remaining of the microfibrils in the surface. And in our imagine, at the end, we have something like this. Elastin in the center, elastin occupy the center, and fibrillin or microfibrils remain on the surface. So the elastic fiber have a shape something like this. In our body, we have elastic in two forms. Elastic fibers in two forms. Sometimes they make a fenestrated lamella or fenestrated sheet, something like this, especially in the large blood vessel like aorta, in the blood vessel wall like aorta, we have a fenestrated sheet of elastin, call it the lamella. Here you can see stained this lamella, and in most of the time we have a fibers, something like this, especially in our skin. Here also shows the formation of the elastic fibers. You see the elastin molecules first attached together by a special cross-link. This special cross-link called desmosine. In fact, these cross-links formed by 4 modified lysine amino acid. 2 from these molecules and 2 from another elastin molecules cross-link to each other and make a ring between these 4 amino acid and call this ring desmosine. And you can see the elastin molecules cross-linked together by this special cross-link desmosine. This slide shows us why the elastic fiber have rubber-like property. You see single elastin molecules here, and you see each molecules have a coil conformations. Why they have coil conformation? Because each molecules have a hydrophobic domain and should hide this hydrophobic domain in connective tissue. So when we stretched something like this, when we stretch these fibers, in fact we straighten the molecules by force, and when we release it, again these molecules form a random coil conformations. By stretching, we straighten them, and by relax, again they form a coil conformations. Some people have a mutation in fibrillin genes, so they cannot produce correct elastic fibers. These patients called Marfan syndromes. In these people's in their body, they don't have normal elastic fibers. So you can see they have a musculoskeletal problems, especially they have long fingers, call them arachnodactyly. They have like a spider fingers, and also they have a problem in the large blood vessel, especially in aorta. They have a swelling in the aorta called aneurysm. These structures or this defect part is very prone to rupture, and this part rupture very easily. And also our lens in our eyes fixed in the middle of eyes by some thin fibrils called zonular fibrils. This zonular fibrils is formed from the fibrillin. So this patient doesn't have these fibrils, so the lens is free in their eyes. And when we have a eye movement, for example, the left and right or up and down, we can see the border of the lens because the lens is free in our eyes.